Hello, I'm Dr. Jeongho Cha. I'm the founder and head doctor of Mina Plastic Surgery. Today we'll be talking about the eyelid surgery. You're probably not familiar with what a mono eyelid is. It's restricted to East Asian population, in which the eyelid is, when you open your eyelids, there's no crease there. So when you open, you don't have a crease, and it just is in one piece. That's why we call it a mono eyelid. Now, double eyelid is that when you close your eyes, you can see the creases here. And the skin itself is attached to the levator muscles that opens your eyes on the inside. So when you open, that creases fold, and that's what we call a double eyelid here in Korea. The candidate for double eyelid surgery first is, of course, those people with mono eyelids who want their eyelids to look a little more discreet, a little larger. So for those people with mono eyelids, usually have when they open their eyes, their eyelids are covering their eyes. They feel that making their eyes a little larger, and also with double eyelid lines, you can see the outlines of the eyelids a little more discreet. And larger eyes and a little more discreet, distinctive eyes are commonly considered more beautiful. So when we do the surgery, we literally make that crease on the inside. So we can do it either by making the incisions and suture it on the muscles itself. That's what we call the incisional method. And also there's a simpler method in which we only just use the threads. It goes in and out, and just that thread itself is holding the double eyelid crease there. Okay, so the incisional method can be done on almost everybody, and the non-incisional method is a lot simpler, but that means that the strength of the double eyelid retaining is a lot less. So for those people with lots of resistance against the double eyelid crease, are not a perfect candidate for the non-incisional method. Resistance to a double eyelid line is where you make a double eyelid line, and when you just leave it, it just goes right back to its normal state. You can actually test it yourself at home. You can use either a toothpick or a paper clip and make a double eyelid with the toothpick or a paper clip, and you remove the lines here, and it immediately goes back to its normal state. Then that means that you are very resistant to the double eyelid. There are lots of reasons for resistance against double eyelid crease. First, it may be too much fat tissues on the upper eyelid areas, which causes the double eyelid crease to immediately go back to its normal state. And second, it may be because the soft tissues, the skin and the muscles on the outer portion to be a little too thick. That also causes the skin to prevent it from folding. So in that case, we should make the incisional methods. If it's too much, we can remove it, or we can just reposition it and just put that away from the double eyelid crease line there. And also, we probably would need to excise the excess skin on the outside and make it a clean double eyelid lines, and do the sutures on the outside as well. The choice between incisional method and non-incisional method is totally up to the condition of your own eyelids. If you are resistant to non-incisional methods, then in that case, if we perform the non-incisional methods, there's a very high possibility that the double eyelid crease will just fade away and go back to its original state. And also, it may not look as pretty as what we want. So in that case, I recommend that we do the incisional methods and do it the proper way. But of course, if you are a candidate for the non-incisional methods, and if we make the simulation with the eyelids, double eyelid crease, and it just stays there, then we wouldn't need the incisional methods. After double eyelid surgery, of course, we do the dressings on the wound sites, but there's not a lot of things that's required for the aftercare of the double eyelid surgery. For the incisional methods, we remove the stitches 1 week after surgery. And for the non-incisional method, of course, no stitches required, but in one of the insertion points, one of the insertion point may be a little larger than a pinpoint, so I just do the stitches on that point, and that goes away in 3 days. So 3 days for non-incisional methods and 7 days for the incisional methods. We remove the stitches. After that, you're free to do whatever you used to do. Recovery time varies very differently depending on each and every person. The eyelid area is one of the most swelling parts in the body parts. If you just get a mosquito bite, it's going to be very large. And of course it goes away very quickly. And on average, in about 2 weeks, 80% of the swelling goes away. 1 month later, it will look normal. Unless you tell anybody that you received surgery, they're not going to know.
Gangnam is famous for plastic surgery, and Mina plastic surgery has distinguished itself as a leader in the field. Dr. Cha Jeongho, a fluent English speaker with a background in reconstructive surgery, provides amazing results even in the most difficult cases, including corrective surgery for unsatisfied results from other clinics. For a free consultation, contact us at minaplasticsurgery.official@gmail.com. And from all of us at Mina Plastic Surgery, thank you for watching.